Okay. Okay, great. So welcome again to our session number 2 on our health equity approaches to preventing sexual and intimate partner violence web conference series. This session is looking at underlying factors that contribute to violence and safety. My name again is Ashley Klein Jimenez. I'm with Prevent Connect, and Prevent Connect is a national project of Valor US sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or Valor. We have a few objectives for you all today. We'll be talking specifically about economic supports as an underlying factor that contributes to violence and safety, thinking about some effective strategies to advance health equity through this strategy, and then also hearing from our presenters as they discuss some successes and barriers to implementing this strategy and advancing health equity. So I'm excited to introduce you all to our guests today. We have Nikki from the Delaware Coalition Against Domestic Violence to talk about some of the RPE work that's happening in Delaware. Then we have Cynthia and Krista from the Rhode Island Coalition Against Domestic Violence sharing about some of their work with Delta Impact. So I'll pass it over to them in just a minute. But I did just want to highlight that we have really kind of framed this conversation in this web conference series around these 2 publications that were released in the last year or so from our partners at the National Sexual Violence Resource Center and the National Resource Center on Domestic Violence. These are really great resources and tools for thinking about health equity approaches. We, in the first session, we highlighted and looked at some of the ways that people are advancing health equity. This session is going to touch on a couple of these different strategies, specifically looking at underlying factors, but there's also elements of each of these, I think, in the work that we'll be hearing in sessions 2 and 3. There's also in the Back to Basics document, there's this list of ways to build capacity for health equity. So again, I just want to kind of steer you to those documents as you're continuing to implement health equity strategies. I also wanted to lift up this infographic from the California Department of Public Health. Again, today we're going to specifically be looking at strengthening economic supports, and this infographic, I think, does a really great job of thinking of kind of walking folks through the connections and also giving some examples of what strengthening economic security to prevent sexual violence could look like. So I'll make sure you have this link as well. And then just, Mighty in the first session, Mighty from APHA started us off by just kind of highlighting that advancing equity is a process and an outcome. It's how we implement programs, how we create programs, how we think about how our strategies are getting to the most impacted communities. And then it's also the outcome of what are the outcomes of our strategies on equity and advancing equity and diminishing the inequities. So I wanted to lift that up. And then finally, this was something that Mighty walked us through a little bit in the first session again, around Kamara P. Jones's work looking at barriers to achieving health equity. And Dr. Jones outlines these 7 cultural and societal barriers to achieving health equity in the US, with the first being a narrow focus on the individual, which really kind of make systems and structures that drive inequity either invisible or just not relevant to people. And it creates a really limited sense of dependence on one another, leading to a belief that collective efficacy isn't going to get us anywhere. Another barrier that Dr. Jones outlines is a ahistorical stance that allows our present views to become really disconnected from the past, and it allows the current distribution as inequitable as it is, to be seen as just kind of happenstance, right? Like, this is the way it is, instead of tying it to a legacy of colonialism and racism, and really leads to people just kind of thinking systems and structures are, they just accept them, that's the way they are, it's the way they've always been. The third cultural barrier that Dr. Jones identifies is the myth of meritocracy, the story, you know, the bootstrap story. If you work hard in this country, you'll make it. And Dr. Jones says that this uplifts the false idea that everyone is on an equal playing field, and also really is a big contributor to the denial of racism. And then the myth of a zero-sum game ties into many of these other barriers by fostering a sense of if you gain, I lose, and vice versa. And it's a type of competition instead of cooperation amongst all of us. And I wanted to just quote Dr. Jones. What she says about this barrier is that it's as if I don't want you to come to my dinner table because I think that you will just come and eat up all of the food without recognizing that you are bringing all kinds of cakes and pies and roasts and fruits and salads with you. It comes from two deeply held beliefs that you have nothing of value to offer and that I have everything that I need at my table. Neither of those beliefs is ever true. That quote has really stuck with me. So I wanted to share that here. And then limited future orientation refers to the disregard that this country exhibits towards the future and specifically children and the planet. So Dr. Jones in her work shares examples from Native and East African communities where there's a lot of consideration taken into how current actions will impact the future. Finally, the myth of American exceptionalism allows for a false sense of entitlement and lots of disinterest in learning from others' experiences outside of the US. And Dr. Jones cites the handling of the COVID-19 pandemic in the US as an example. And then finally, a seventh barrier to achieving health equity is white supremacist ideology. And so like all of our work, Dr. Jones tells us that solutions to these barriers will take all of us, take a multi-sector approach, and an approach that really centers an interest in each other. Right? So hearing each other's stories, learning from one another. So I just wanted to lift those up because Mighty did share them with us. And I think that one of the ways that white supremacy functions in my work is just to focus on solutions. But I think it's really important for us to have a deep understanding of what the barriers are in order to craft solutions that will really advance what we're looking for. So with that, I wanted to ask you all, you know, from those barriers, and I can go back, but what barriers are resonating with you in your work to advance health equity? So from the barriers that Dr. Kamara Jones outlines, which ones are resonating with you all? Which ones are you seeing that you're faced with either in your organizations or your communities when you're trying to advance health equity? So thanks, Rebecca. I see Rebecca says white supremacy and zero-sum game. I see limited future orientation. Yeah, I think the limited future orientation one is something that I've been thinking about a lot. Narrow focus on the individual, lots of the white supremacy ideologies. Yeah, Rebecca, I agree with you. They all impact our work. Thanks, Mark. Yeah, thank you all so much for sharing. I think I'll put some other links to where you can find some more of Dr. Jones' writing on these barriers. And I think that the other piece is that she really sees, I think, at least 4 of these as contributors to racism denial in the country. So I will link to that. And with that, I want to introduce you to Nikki. So Nikki, I'm actually going to have you introduce yourself if you don't mind. But I am just really excited to hear about the work that you all are doing in Delaware and to have you share kind of the process that you all have taken in really focusing some of your work on strengthening economic supports. So take it away, Nikki.
Yay. Well, hello, everybody. I am Nikki Kurteval. I work with the Delaware Coalition Against Domestic Violence. So I know some folks are all over the country, so it's about 2 o'clock my time, 11 o'clock on the West Coast. So feel free to keep your cameras off and pour another cup of coffee. I am not a morning person and I understand the struggle, and it's Friday. I'm so happy to be here. I really enjoyed that kind of recap from Ashley and talking about barriers, because we're going to really talk about what we've been working on at the Delaware Coalition and how a lot of the work is definitely impacted, and the barriers impact the work that we do. Specifically, I'm thinking of that white supremacist ideology really impacts the work that went into writing the white paper, and we're going to get into all of that. But so I'm super excited. I have a very strong background in direct service. I worked at the domestic violence shelter here in our local county for, oh my gosh, maybe 4 or 5 years. I'm losing track. I also worked with survivors of crime at Delaware Center for Justice for 4 years. And then I needed a break from direct service. And here I am at the coalition. So super excited to be here with you all. And so we're going to dive right in. So again, I am the Rape Prevention and Education Program Manager. And what Ashley had reached out to us to talk about and to really kind of recap and dive in with you all is the environmental scan in the white paper that we recently published. Super excited to talk about this. It's been a long time coming. And first and foremost, before I dive in, I want to acknowledge that this was not a Nikki project. This was a conjoint effort. There's tons of folks that went into writing this and doing the research. Some of my colleagues have moved on from DCJ, from DC ADV. And so I wanted to shout them out. We had a lot of hands on deck with this, and this was a very large task. And so I don't want to take full credit because there's a lot of other folks that were involved. So here are their names. And then you all will receive this white paper. So I really encourage you to take a deeper dive once Ashley sends out those resources. So we're all here because we are preventionists, or we have a knack for wanting to prevent violence. And I'm sure you all are aware that violence prevention is stopping violence before it occurs in the first place. It's always important for me to ground myself and remind myself of that, because it is so hard to imagine a world without violence. It feels like that lately. It's hard to remind ourselves that it's possible, and it is possible because we have these tools and these awesome resources from CDC. And so just always a kind of like a reminder that violence prevention is stopping violence before it occurs. And so why is prevention important to the RPE program? So we're really focused on policy work, finances, healthcare, childcare, education, and uncovering gender norms. And so let me back up a little bit. As part of our RPE deliverables at Delaware, what we were tasked with was doing an environmental scan. And I'm going to get into the nitty-gritty of that. But so overall, we have done an environmental scan on different policies, both locally, nationwide, and globally, to talk about ways or uncover ways that different policies advance health equity. And so in order to kind of focus our energy and decide exactly what we want to dive into, we have categorized what areas we want to focus on. And these are the main areas that RPE is focused on looking at and uncovering when we did our environmental scan. All of these, of course, help with prevention or lead to prevention. And so, we're going to get into the nitty gritty a little bit later on in the slides, but this is kind of like the bulk of when we're looking at prevention linking back to the RPE program. This is what we're focused on. And so I'm going to ask you all, what are some impacts of sexual violence and intimate partner violence? Feel free to put it in the chat. You don't have to unmute. If you want to, you can. I'm a people person, so I encourage folks to unmute and answer questions and interact. But feel free to put in the chat, what are some impacts of sexual violence and intimate partner violence that you all can think of? So Cynthia saying inability to work, absolutely. And it's okay if we're not fully if we need time to think. Yes, trauma, disruptive childhoods, poor grades, yes, 100%. Brain injury, yes. So here are some impacts that I came up with, that our team has come up with in terms of impacts of sexual and domestic violence. So there's guilt, there's shame, self-blame, embarrassment, fear, and these are definitely not limited. Distrust, sadness, vulnerability, isolation, alienation. Yep, I see a lot of different answers coming in the chat. Lack of control, anger, numbness, and these are definitely not new to all of us. I know we've heard this before, and these are just, this is the tip of the iceberg for a lot of survivors. I've worked with survivors over the years, and this is just really the tip of the iceberg of the true impacts that sexual violence and domestic violence has on an individual and a community. So it's important that we are aware of this when we're doing this research and this work, because it really is important to understand what it is that we're trying to prevent in the first place. That really drives the work for me personally, and I know it drives the work for a lot of us in this field. So this is definitely not a limited list, but some of the main kind of categories that we came up with when we're talking about the impacts of sexual violence. So some of the risk factors for sexual violence, cultural norms that support violence, community poverty and associated conditions, high unemployment and lack of affordable housing. That is a huge factor in Delaware, and I know nationwide we have all of these different resources available post-COVID, and absolutely no safe housing available for survivors. That's been a huge factor when talking about that. That's something that always pops into my mind. Masculinity linked to dominance and aggression and power. And inequity and oppression. So we're going to talk about, what can we do? What are the conditions that we can create to help alleviate these risk factors? And that's exactly what my next slide is about. So importance of prevention. So when Ashley was talking about health equity, and I'm so glad that this is part of the series, prevention helps to influence health equity. When we talk about prevention, when we talk about the different things that we can do to help prevent violence, we're also talking about creating a healthy, more equitable, healthy space, healthy work environment, healthy environment for all folks to live in and to prosper and to work and to be happy and thrive. We only get one go around on planet Earth, and so why not make it a place that is thriving and equitable for all? And so in doing this environmental scan and looking at the various policies and different pieces of literature that existed, we really had this in the back of our head to make sure that we're working towards prevention from a health equity lens, from that standpoint. Importance of prevention. So health equity, the attainment of the highest level of health for all people. To achieve health equity, we need to uncover health disparities and eliminate health equities. And as we know, approaching domestic and sexual violence prevention from a health equity lens is spot on, because it's a public health issue. And so at the forefront, or behind the scenes of all, that is the lens that we choose to continue to use here at the Delaware Coalition Against Domestic Violence. Health inequities, differences in health that are avoidable, unfair, and unjust, resulting from social, economic, and environmental conditions. So importance of prevention when it comes to health equity and preventing sexual and domestic violence. So social justice is a matter of life and death for a lot of folks, for everyone. When we talk about the disparities and inequities, we're talking about folks not being able to, maintain a job because their work might not have a paid leave policy to allow them to take off to take care of loved ones that might be ill. When we talk about social justice as a matter of life and death, we're talking about folks not having policies at their jobs that allow them to go file a protection order, and the list goes on and on. And so it's important to remind ourselves of this and to kind of ground ourselves in this. Inequities in health arise due to circumstances in which people grow, live, work, age, and the systems put in place to deal with illness. The conditions in which people live and die are in turn shaped by political, social, and economic forces. And so understanding the magnitude when it comes to doing our environmental scan. And so we understand that this affects women and women in different areas at a higher disparity than it affects men. And so we looked at the Stop SV technical package, and we chose to look at how we can alleviate or how we can lift up young women and girls to help with the risk factors and create conditions and protective factors to help stop or end gender inequities. And so understanding the magnitude of how sexual violence affects women and girls, not only in the workforce, but in schools from a young age. So young women, women of color, women in the LGBTQ community, women with lower household incomes, women who have food and shelter insecurities, and women with disabilities. So women across the board are affected, and we chose at the Delaware Coalition Against Domestic Violence to focus on the area of how we can uplift women and put women and girls at in different positions and leadership positions, so that we can alleviate that risk factor and really truly help to prevent violence from occurring in the first place. So again, we chose from the Stop SC technical package, strengthening economic supports for young women and families, and really highlighting and trying to uplift young women and girls by strengthening leadership and opportunities for girls and women to thrive, because we know when we do that, we're helping to prevent violence. And so when we decided, when we first started this environmental scan, this was really at the forefront of how can we make sure that we're keeping this, these strategies at the forefront of what our goal is overall, and making sure that this, the different policies that we're researching and uplifting and educating the public about really tie back to strengthening economic supports for women and families, and in turn strengthening, leadership opportunities for girls as well. So specifically what we're going to dive into now is exactly what were the steps that we took to conduct this environmental scan. And so from this environmental scan, we wrote a white paper, and Ashley is going to be sharing those resources later, but I would highly encourage folks to read through a white paper. We also have a couple of other resources that I sent over. Oh, thank you so much, Ashley. Ashley just dropped that in the chat. But from the white paper and from our environmental scan, we created what is called our Invest Delaware group. And I'm going to get into that a little bit later, but first I kind of want to break down exactly what we did when we dove into this environmental scan and how we went about doing it. So what does an environmental scan look like? So since we were tasked with this about 2 years ago, we were drawing blanks. We had done so much kind of like browsing and research on, have other states done this? What does that look like? And so we had a really brilliant prevention policy specialist. Her name is Sierra Bryant. She is not at the coalition anymore, but what she did was she first did a kind of like a dive into what has been done at other state coalitions. Have other state coalitions done this? And if so, what does that look like? And so she reached out to various state coalitions, had great conversations with folks, and did a little bit of research using some of our different tools, such as Casetext, which is like a legal search engine, Atlas, which is also another search engine that I know a lot of universities use, and you're able to kind of get a little bit more literature reviews and see like kind of what has already been out there. And so our main goal when looking at this environmental scan was, again, to do that preliminary research. Our goal is to look across different workplaces, statewide, nationwide, and even globally, to see what policies exist in the workplace that help to lead to violence prevention. And we were open to looking at all different types of policies. We didn't have one specific policy in mind. It was more so that Sierra's research dictated what policies we focused on. And so, for example, she found a great amount of research on paid parental and family leave. And so we recently had paid family and medical leave passed through legislation in Delaware, which was a huge win for us. But so she found different states and workplaces that had model policies for what paid and family leave should look like, and was able to compile that into a really beautiful spreadsheet. And I was gonna take copies and put them up here, but I decided to not overwhelm folks with that. But all of that information is in our white paper. And so she compiled these beautiful spreadsheets with all these different model policies across different states, across different corporations, across certain countries, specifically that have wonderful model policies. And she really put these into different buckets. And so we'll talk more about those buckets in a minute, but truly a lot of work went into this environmental scan, months and months of research and hours of reading through lit reviews, different policies at different organizations, and really just using these search engines to find what exists, using her networking skills to find out who has done this before, or in what way can we use some of the tools and resources that exist to continue that work. And so I just wanted to put an environmental scan definition for those folks who, might not have heard of this type of work before, but it's just the ongoing tracking of trends and occurrences in an organization, in an organization's internal and external environment. The results are helpful in shaping goals and strategies. And so from this environmental scan, we compiled our white paper, which helped us to create our Invest Delaware group. And so that was our main goal, was to create a group that discussed different ways that we can help to prevent violence by educating the public sphere about workplace policies as a way to prevent violence. But before we got to that point, we needed to start with our environmental scan. So again, we surveyed and looked at different data to identify external opportunities and threats that can influence future decisions. So similar to a SWOT analysis, this should be used during strategic planning process. So this was the very first initial step, was to survey what exists, what resources are out there, who has done this before, and if so, how can we use some of those, those tools that have already put in place to help us advance the work that we want to advance. And if folks have any questions, I know we'll have time towards the end, but please feel free to put them in the chat, and I will definitely look at them as we're going. And so we pulled together this chart to kind of put it into a better way to understand. So we started with our policy scan, again, looking at what already exists, what research is out there, what policies can we look at, what lists do we want to start with. We looked at government policies, workplace policies, at government legislation, and financial institutions. Those were like the three main buckets that we chose to look at: so government, workplace, and financial institutions. We looked at government legislation. We scoured through the Delaware General Assembly's website to look at what bills have been passed, what bills are on the table to be reviewed when it comes to the different policies that we've researched or want to research. We looked at different workplaces. We looked at financial institutions. We found that a lot of places had really great, again, paid leave for individuals who need to take time off to care for loved ones. We found that there were lactation policies for chest feeding moms that needed safe spaces to be able to do that so they can continue to come to work. We found really great on-site childcare policies that workplaces and financial institutions had in place, so that, again, working parents can continue to come to work to provide for their families and not have to take off to stay home. So again, a lot of work went into this. This is just a quick snapshot of the many hours of deep dives and research that went into this scan. Sierra conducted, again, a literature review, and to give you a little bit of an idea and a breakdown of that lit review, she looked at domestic violence, sexual violence, and economic justice as her main categories of policies to look at and to see how those policies affected those areas, because our main goal here is clearly to prevent violence. And so those were the main categories. And through this lens, we were able to, again, find different policies such as non-discrimination policies, on-site childcare policies, anti-sexual harassment policies, mental health related policies such as building in mental health days for folks to be able to use those days to take care of themselves in whatever capacity that they need to, flexible workplace policies, again, lactation policies, PTO and family leave. And so this was prior to our paid family and medical leave passing in the state of Delaware. So really, this is very new to our state too. And we're super excited that it all kind of cohesively worked out around the same time that it was passed, because it just goes to show how important this work is and how relevant it is to violence prevention specifically. And so I highlighted here a piece of research from one of the literature reviews that Sierra did. And so this right here is paid parental leave. And it just, again, highlights the fact that paid parental leave has the potential to strengthen economic supports reducing family discord, and providing opportunities to empower women. And that was one of our goals. That was one of our pieces that we chose from the Stop SB technical package, or our strategy that we chose rather. And so paid parental leave was really at the top of our or on our radar when we were looking and doing this environmental scan. Some more notes are that it promotes attitudes and beliefs about women as equals, thereby increasing gender inequity. And so again, at the forefront of the work that we were doing, this was that using that prevention lens was behind it. I took a snapshot of some of the local economic justice partners that Sierra highlighted when she was doing this environmental scan, really compiling a list of what folks are doing the work well, meaning what organizations or places have really good policies that exist already that we could look further into to see how we can help promote those policies in other places. And an organization that has been doing amazing work in the state of Delaware is the Women's Leadership Initiative. They're located at University of Delaware. And so their main mission or a description is just that the Women's Leadership Initiative envisions a world where gender inequity advances opportunities for all. The Women's Leadership Initiative works with students, faculty, and alumni in the community to address these issues by creating conditions for people to become gender savvy. And so this was just to highlight an example of one of the partners that we kind of wanted to engage further when we were doing our environmental scan and also creating our white paper and creating our economic opportunities for women group. And so we'll talk about that in a little bit, but I just wanted to highlight that we did keep track of some of our partners that we did want to reach out to. Another example of our corporations of workplace policies was one through Capital One. And again, it's their parental leave. So the description that Sierra had wrote is that parental leave associates can take 18 weeks for maternity leave and 8 weeks for paternity leave, which is wonderful because in turn, that leads to violence prevention because we're allowing folks to continue to receive a paycheck, spend time with their loved ones, their newborns, and continue to show up to work and to take time off from work and still not have to worry about, not having an income and taking care of their loved ones. And so that is exactly the type of policy that we were looking for and wanted to kind of to highlight that here. Some notable countries, I did mention that we not only looked in the state of Delaware, but nationally and globally. Norway was a country that Sierra had done some research on and found that mothers were allowed 15 weeks for 100% parental benefits and 19 weeks for 80% of parental benefits. And so this is just amazing because again, it is highly linked to violence prevention. We're allowing folks to continue to receive an income while also taking care of their loved ones. And so we highlighted this as a notable country and doing the research that we were doing. So we also kind of, once we were done with our research, which again took a few months, lots of hours of reading and compiling spreadsheets and comparing, different employers and different states to what's happening locally. We decided to pull together where Delaware fell on when it comes to different policies. And so here is kind of a little chart of our economic justice policies with major employees or employers in Delaware. And so we have a lot of employers with anti-discrimination and equal employment policies. We have a good chunk of paid parental leave and child family care policies, our DV policies and family planning policies are about equal. I don't have the percentages in front of me, but I can send that to folks if they're interested. This was kind of like I thought a more unique way to kind of show and highlight where we land. Lactation policies, we could do better. Flexible schedules, it looks like we could do better. And so all of these different policies were policies that we looked at on our scan and policies that are linked back to violence prevention and helping to highlight and raise up health equity. And so all of this work and this research really helped to lead us to decide after doing this deep dive, where do we want to go with this research? What is the story that we want to tell? And so from doing that research, we were able to pull together various fact sheets about economic justice as violence prevention and why it is violence prevention based off of the different strategies that we chose and the research that we have done. And so in this fact sheet, which I believe I did not send to Ashley to share with you all, but I am more than happy to do so. Again, we were able to talk about the different links with poor economic security and barriers that survivors of violence face, and how having good workplace policies in places where folks are working will help to lead and alleviate violence and help to lead to violence prevention. And so we've compiled various fact sheets. We compiled our lovely economic justice white paper that I encourage folks to read. It's a really good deep dive into that environmental scan that was done and the work that was done. And it helps to really put this in a way that's digestible for the public to understand the link between violence prevention and workplace policies, and how there's various workplace policies that folks can take on in the workplace in order to promote or prevent violence, but also promote healthy work environments for people. And so there's really a buy-in not only from violence prevention standpoint, but boosting the morale of folks that are in the workplace, and the employees and the employers that are doing the work there. And so I highly encourage folks to read this. And if you have questions at all, please reach out. I love talking about this. I think it's important work. And so from the white paper and from the environmental scan, we then were tasked with creating an economic opportunities for women group, which we named Invest Delaware. We love our acronyms in Delaware. And so Invest Delaware stands for Integrating Nonviolence Economic Strategies Throughout Delaware. And what Invest Delaware is, it is a community of partners that we have reached out to talk about how promoting and educating the public on workplace policies can help lead to violence prevention, and getting buy-in from different workplaces in the state of Delaware to educate them about that, and to also give them that kind of information that it not only helps to prevent violence, but it helps to boost staff morale. There's lots of great benefits of updating and having these policies, and here's why we want you to do that. So we're still, Invest Delaware is about 1.5 years old. We have some wonderful partners. The Women's Advancement Advocacy Group, SARC, is one of our statewide sexual violence or sexual assault resource center. Contact Lifeline is also another sexual violence resource center. And the study of prevention of gender-based violence at the University of Delaware has been heavily involved in creating this Invest Delaware group. And so we're really, again, the group has decided to focus on the two policies from the white paper, so lactation policies and paid family and medical leave policies, to really lift those policies up, to reach out to different organizations or different workplaces to help them understand why having great lactation policies or paid family leave policies is, again, violence prevention, but also great for the organization. And so currently we're working on creating checklists for these organizations to look at. So we're creating these different checklists to show what a model policy for lactation looks like. What is the bare minimum that I would have to do as an employer to kind of have something in place, and what is the absolute kind of gold standard that I can do. And so we're creating these checklists to try to get buy-in from different employers in Delaware, and to really lift up the work of the white paper. And so we're still fleshing those ideas out. We've worked really closely with our team on Invest Delaware, and we've reached out to different breastfeeding coalitions across the state, such as Washington. They do already have a wonderful checklist created that we're going to we've gotten permission to kind of reuse and update with our own information. And so Invest Delaware continues to grow and thrive, and we're super excited about the potential that it has to continue to help promote violence prevention in our state. So again, we continue to monitor the Delaware General Assembly for different bills that are introduced that affect SA and DV survivors. Paid family leave just passed not that long ago. This has continued to to help us to see what is coming down the pike as far as bills or legislation. We have an awesome prevention policy specialist that just started. Her name is Shelby, and so she's going to be really tracking this, the Delaware General Assembly's website, taking that information back to Invest and in different spaces so that we can keep track of what's coming up. Always using our research that we've done with our environmental scan and our white paper as kind of like our grounding starting point, and seeing where can we continue to go with that research. And so all of this leads to policy changes, which we know leads to violence prevention. It really addresses the outer layer of the social ecological model, and making those greater changes to help advance health equity, help prevent violence from occurring, and helping to lead to thriving communities, and that's what our goal is, right? And so we're super excited about the research. It's only really just begun. I'm excited to be part of the DCADV and to see where we go next and how Invest grows. If anybody has questions, feel free to reach out to me. More than happy to hop on a call, walk you through the research if you're interested in doing this at your coalition or anything like that. So feel free to reach out with any questions, and I really appreciate everybody taking the time to listen. Yeah, I will pass it to Ashley.
Thank you so much, Nikki. I appreciate everything that you just shared with us so much. And yeah, I think we'll definitely have to check in, because I know that so much of the work that you all are doing, you've spent so much time gearing up for. So it'll be great to see what happens in the next couple of years. And I just want to say, I really appreciate you walking us through the environmental scan. I'm such a literal person that when I hear that, I think of getting out some binoculars, literally doing a scan. So I just want to appreciate you for that. And then if you haven't, for everyone in the audience, if you haven't read the white paper, really encourage you to take a look at it. I think it does such a nice job of laying out the connections, offering up policy examples, and then you really do spend some good time with your materials making the case to businesses that this is also good for business, which I think, is an important part. Sometimes preventing violence isn't enough. And so, yeah, I just thank you so much for sharing about all the work happening in Delaware. I know you have a great team behind you and with you. So yeah, if folks have questions for Nikki, feel free to put them in the chat. We have a small enough group that you're welcome to come off mute. I think I allowed. And we can pause the recording too if you have a question that you don't want recorded. So yeah, I'll keep monitoring the chat for questions for Nikki. We'll come back, but at this time, I do want to bring in our colleagues from the Rhode Island Coalition. I feel like I'm spending the day on the East Coast. And so I want to invite Krista and Cynthia. If you both would introduce yourselves, and then I know that like Delaware, one of the prevention strategies that you all are focusing on at the state level through your Delta Impact funding is strengthening economic support policies. And so I'm wondering if you would share how you all landed on that strategy for Rhode Island, and then about how it's unfolded over time. Tell that story. So I will pass it over to Krista and Cynthia.
Awesome. Thank you, Ashley. We're so happy to be here with you all today and here with Prevent Connect. Can you hear me okay?
You sound great.
Awesome. Thanks, Nikki, for sharing about the work happening in Delaware. I learned so much from your presentation, and I'm going to have to go back and listen some more. We're grateful to be in this space with you. As Ashley said, I'm Krista D'Amico. I use she, her pronouns, and I am the Director of Prevention at the Rhode Island Coalition Against Domestic Violence. I've been here just about 9 years and in the prevention work for going on 4 of those years. And you might hear us say RICADV throughout the presentation. That's our acronym. So we're referring to the Rhode Island Coalition. And I'll pause so Cynthia, you can say hello and introduce yourself.
Thank you. Hey, everybody. My name is Cynthia Roberts, and I use she, her pronouns. It's really exciting to be here. I echo the same gratitude to Ashley for hosting this and Prevent Connect. And also, it's really exciting to hear about the work that Nikki shared with us that Delaware is engaged in. And I'm the evaluator here at the coalition, and I've been here almost as long as Krista, maybe like more like 8.5 years. Okay, I'm turning it back over to you, Krista. Thank you.
Thanks, Cynthia. We'd also like to acknowledge the staff at the Coalition Against Domestic Violence in Rhode Island and our organizational partners and community members who help co-create and shape our prevention work. We are the folks speaking today, but it goes without saying that this presentation and the work that we'll discuss is the reflection of the wisdom and energy of many, many people. So we're going to take a storytelling approach today to share about our work in Rhode Island when we're implementing and evaluating complex social change work that's constantly adapting and changing in an ever-shifting context, work that unfolds over long periods of time, and we're trying to effectively show progress and measure change. We know stories are a compelling way and responsive way to help us do this. And they're also a way we can lift up and center the voices and leadership of communities most impacted by the issues we're trying to address, including intimate partner violence, and those who are being reached by our strategies, participating in them, and often leading and meaningfully contributing to the strategies and programs we're focusing on to try to create that change. So we're modeling a storytelling approach today with the time that we have on this panel. Cynthia and I are going to tell a story about one of our Delta Impact strategies and how it has unfolded over the past few years. As Ashley said, it focuses on strengthening economic supports policies in Rhode Island. And in a few slides, we'll also watch a video we created with some of our community partners. This story is really one of organizational learning, building our capacity across teams at our coalition to bring a primary prevention lens to our policy work and an understanding of policy change to our prevention work. It's a story of how we're aspiring to live our anti-racism values, hold ourselves accountable to how we say we do our work, and center the experiences of the people most impacted by intimate partner violence. This is just one story, it's not the story, and the journey is ongoing. We'll have to make some calls about time as we go because we're still figuring out how to share this narrative and how much time it takes. As it is, I'm probably taking up too much time on this intro slide. So we'll adjust as we go. And also please feel free to put thoughts or questions in the chat or raise your hand if you'd like to come off mute and speak. So here we go. Our funding cycle for the current Delta funding from the Centers for Disease Control, Delta Impact, began in 2018. And we applied for this funding, knowing we wanted to focus on strengthening economic supports for families as one of the areas of the CDC's technical package for preventing intimate partner violence that made sense for our organization. Our policy team was already doing a lot of work in this area, involved in efforts to raise the minimum wage, close unjust pay gaps, and expand paid sick leave, for example. And they focused on how these policies support victims and survivors of domestic violence to be financially secure, have more options and fewer barriers. And that's our policy team on the slide. In the center and to the right, Ian and John, with one of our economic justice sector policy partners pictured. So we felt there was a potential and opportunity to bring primary prevention into this work because we know these policies not only support victims and survivors, but help change the conditions in our communities to prevent violence before it has a chance to start. The things that keep survivors safe are the things that keep all of us safe. So we set out to understand the landscape and strengthen our partnerships. Our policy team was already very active on many of the coalitions, the policy coalitions in Rhode Island, and held a lot of those relationships. But we also needed to understand the work on the prevention team and be present at these tables. In Rhode Island, as I'm sure it is in many places, relationships and trust are very important. Seeing people, recognizing faces and names, getting to know each other and showing up consistently in support of one another's work is really critical. Even though mostly later in the strategy, this was on Zoom, it was still really important to show up. And it wasn't enough to have the funding and have our policy team continue to be present in those spaces. We needed to be there ourselves, bring our language and our lens to these conversations. And importantly too, there are restrictions to our Delta funding that prohibit us from some aspects of the policy work. So it was really helpful to be able to navigate that together, knowing that the prevention team could do certain work in certain areas, and the policy team could take over around doing more direct advocacy work. So we started attending statewide policy coalition meetings, learning about the different economic supports policies being worked on in the state. And we have listed on this slide 3 of the organizations we really started building with, because those were some of the state level policy organizations that our policy team was already working closely with. And we saw them as key players and a place to start. So that's the Economic Progress Institute of Rhode Island, Women's Fund of Rhode Island, and Rhode Island Working Families Party. We also needed to understand the landscape of policy in Rhode Island and build up our knowledge base. And I'm definitely over time, so I need to pick up the pace. One way we wanted to do this, or one way we set out to do this, was to hold an economic justice visioning session with folks from across our movement. So we thought early on, perhaps, that the coalition would identify an issue that wasn't being worked on yet in the state and could benefit from some leadership and capacity in terms of an organization taking ownership of that issue, being a convener, and bringing together stakeholders around that focus. And so that's why we held this retreat, to learn where that gap might exist and where we could put our focus as a convener. And we invited survivors, advocates, member agencies, policy partners, and state and community-based organizations to participate in that day with us. And those are the photos you see on this slide. We also, from that experience, realized we needed a little bit more information and details. So we held several key informant interviews with some of our state level policy partners shortly thereafter, so that we could learn more. The end of 2019 and early months of 2020 was a time when we were reflecting on what we had learned so far from that economic justice visioning session, from the interviews we had held, and from being at the table with our partners. So we were about 2 years into the strategy, and it was organically a time of asking questions, making meaning of what was happening, where we were in the strategy, and where we wanted to go. We knew we would continue to stay engaged with state level organizations. So that image on the left, that is a research report that was released in January of 2020. Cynthia and I went to the kickoff event for that piece of research. And we were also establishing new partnerships. So early in 2020, we connected with the Raise the Bar Coalition, a community-led coalition working to create more equitable staffing and wages and conditions for nursing home and direct care workers. But we had made some critical observations up to this point. So most issues were already being worked on by our existing state level partners, coalitions and campaigns in Rhode Island. And we didn't really see a gap or a need for us to be a convener around a certain issue. The more we learned, the more we heard that other groups or campaigns already existed to lead on those issues. And most of these groups were being convened by white-led mainstream organizations. So we were also aware that that was the dominant model on the state level, and maybe we didn't need to replicate that. Other observations, the goals of these groups were often informed by a racial equity lens, but the culture and practices did not necessarily embody racial equity, and that policy partners' tactics and our primary prevention approaches were very different. So I'll speak to that one first. Those spaces often are very fast-paced and tactical, and they're working in short-term goals. So maybe a 6-month legislative strategy and working month to month or even week to week. Who needs to be reached? What are the mechanisms of specific policies? What are the whims and personalities of different decision makers? And that was their lane, and that's important work that needs to get done. Meanwhile, we're all about relational, transformational, gradual, long view approaches and empowering the community. And we were at some of these tables for 2 years on a monthly or more frequent basis and still didn't feel like we knew who was at the table, that they knew us, that they knew why we were there. And the goals of these groups, as I mentioned, were often informed by racial equity to aiming to address inequities in the community, but the culture and practices of the groups did not embody that. And so some things we didn't see at the table were representation of community members most impacted by the issues being worked on, or robust community engagement strategies. It's one thing to define a priority and then try to garner community support, and another to mobilize the community so they can define the priority. Same with looking at data to support the decision you've already made about what you're going to focus on versus empowering the people reflected in the data with the lived experience to be part of the decision-making process to actually set the priorities. And we bring this up not to say that those groups were doing things wrong and we were doing things right, or they had work to do and we have all of this figured out. We bring this up because one of our goals going into Delta Impact was related to who we would reach and the change we would measure. And we aim to influence state level organizations to integrate health and racial equity into their work, possibly by trainings or being that convener or lead in a policy area. And what we learned is that the organizations already had the framing and the language and the values around racial equity. It was really the deepening of the practices and the ways of doing the work that needed to be sharpened. And that isn't work we can do for them. We need to do that work on our own organization. Every organization needs to do that, that deep ongoing reflection and action. So we realized maybe this wasn't a leverage point for our strategy, and we had to ask ourselves, what can we actually influence? And this was right around the onset of the COVID-19 pandemic. And of course, a few months later, the racial justice uprisings across the country and the world. So we went from what next to asking what now with many, many others. And so as we know, the COVID pandemic only served to magnify and make more plainly visible the inequities and oppressions in our country and in the state of Rhode Island. And we know that these are the root causes of intimate partner violence, and that this is what our primary prevention work seeks to address. So we were really called to pivot our strategy to align a public health approach to prevention with our aspiring anti-racism values in action, and intentionally made the decision to pivot our strategy and change who we were centering. No longer mainstream policy organizations, but also working on ourselves and amplifying organizations led by Black, Indigenous, people of color, individuals, and culturally specific organizations. So we knew as we were making those observations about others that we also needed to hold the mirror up to ourselves and ask, what can we do differently? And what's our opportunity to leverage our power and resources? And we have been doing that work as an organization for about 15 years in terms of anti-racism organizational development work. So this was not a new conversation on an organizational level, but it was a big pivot in the context of this strategy. And so with that, I will pause, and we are going to share a video that kind of exemplifies this pivot and features some of our community partners.
Let me unmute myself, and then here we go.
So when we imagine a world without domestic violence, one where children born tomorrow never witness or experience abuse, we should ask ourselves, what do we see? What does this world look like?
Our communities of color, women and non-binary folks have access to resources and also are receiving investment from state and local institutions into the health of our communities.
Education and awareness, while very important and crucial, cannot end domestic violence alone. We must also shift the attitudes and behaviors that perpetuate this violence and make sure that our communities are vibrant, safe, healthy places for everyone.
It's culture change. We have to get to the root cause of why we even have intimate partner violence.
We cannot end domestic violence until we end oppression in all its forms.
Equal access to education, things like healthy food, resources, healthcare, parks, and green spaces will not only help build healthy communities, but research tells us it will help prevent domestic violence before it has a chance to start.
The COVID-19 pandemic has intensified many of the factors that increase the likelihood domestic violence will occur, including economic insecurity, poverty, unemployment, and social isolation.
Communities of color have been severely impacted by COVID-19, not just with disproportionate number of cases, but also by the economic impact. The reality is that our communities were in crisis before the pandemic had happened. Not enough jobs that pay a living wage, a serious lack of affordable housing, issues around food insecurity and childcare.
We want to engage individuals that are facing those challenges so that they not only face that challenge, but they can see how they're an important part of the community. I think that's going to make a difference in domestic violence because we're committed to engaging people and to ensuring that they have a voice in their community.
The fact that domestic violence, economic violence, state violence are huge systems impacting the lives of women, women of color, non-binary folks in a way that does not allow them to be whole. That takes away their humanity. What we're trying to do is get in front of that. How do we use strategies of prevention? How do we use alternative strategies than just the systems that are out here that say they're here for us, whether it's health and human services, whether it's schools. What is it that we want for our communities? What is it we want for our own lives? What do we want for our families?
Society and especially our government does not actually recognize the humanity of folks. They don't recognize the fact that our young people don't have reliable housing, clean water, electricity, technology, internet access, and they are not food secure.
We need to support the leadership of community-based organizations to set the policy agenda and do community-led solutions.
Our goal is to serve like all different types of youth and people of color within our community, especially when it comes to like education, to make sure people get like equitable education and resources. Because we come from a time where people of my descent couldn't even get a valid education and weren't allowed to be educated.
Like, why is it such a struggle to actually care about our students enough to be able to fund them the resources that they need, whether it's mental health, whether it is even after school programming? Like, we're not funded for that. Knowing that there is a whole bunch of research and data that actually says like, this is helpful to the Black and brown students in this community. But yet we still, there's a gap.
But when we think about the public education system and when we think about the state takeover of Providence, there's this verbal commitment to anti-racist practices, ideologies, pedagogy, but it's not a commitment through sort of tangible actions. How do you distinguish between sort of performative sort of allyship and actual real sort of organizing and building and systems and institutional change?
We know historically young folks have always contributed to the biggest movements, civil rights movements in our lifetimes.
We're working every day to advocate for better futures for other generations, advocating for certain bills for education. It's tough because I'm like, I need this now. Why is it taking so long for you to actually do something that is necessary? It's a really tough time just waiting, but you know, sometimes waiting is worth it.
Not all problems can be solved in a day or a minute. It involves dialogue and it involves a commitment. And we often have discussions about what can we do differently that will help the community more. And that is the question. That is the hope that we have, that things can improve for people.
It's about building a shared vision, helping communities have more collective power. It takes a lot of unlearning and decentering of like one's self and one's whiteness, in my case, to be part of what that change is.
Sometimes we forget that we're building together, we're working for the same things and working towards the same things. We need to work on ourselves together.
We know that it's not easy work. Organizations have different cultures and different ways to communicate, but we have to take a stand.
There's this assumption that leadership looks one way, and it doesn't. When I think about leadership, I think about folks who are walking down the street. I think about women who I went to school with. I think about all of us lifting up and working with the person next to us. And we do that through lending circles. We do that through mutual aid work. We do that through spiritual healing work. How do we collectively begin to invest in each other? How do we heal with one another? How do we redefine what leadership looks like? Not patriarchy. We are redefining a set of systems that are oppressive and saying it ain't gonna work. It needs to look different, and we have alternative strategies.
While we're living through times of intense hardship and suffering for so many of us, this is also a time of emergence and resilience, of reimagining what's possible.
During the pandemic, we've really seen all of the ways that the brilliance and the love and the depth of relationships in our community have shown up across our communities, and also in the work that we've done and stepping up to care for each other. Our communities are inherently worthy and deserve dignity. And if there's one thing this pandemic has done is really demanded space for conversations around alternative solutions.
Change is actually happening. Though it's very slow and it took very long for it to happen, it's still happening. I'm very hopeful because in times of despair and in times of desperation, you can only think of hope.
The people who came before us, they did so much work to get us all to this point, and then now we're carrying it forward into the times that we're living in. What I'm excited about is evolving out loud, like learning and growing and sharing what that looks like.
Our partners are working to transform the conditions in our communities that contribute to domestic violence in order to build an equitable and peaceful world.
It is a world where my grandchildren and all children of the world never witness domestic violence. A world where men's violence against women is not tolerated, and a world where everyone is safe and every person can thrive. And this is absolutely possible.
Thanks, Ashley, for being our tech point person.
Sure.
Hope everyone enjoyed the video. It's so great to see and hear folks in Rhode Island and our partners in this work be in this space with us. So we pivoted from viewing our role as a primary convener and agenda setter and believing we can effectively influence our state level policy partners to deepen their commitment to racial equity practices by modeling that ourselves and communicating outwardly what that looks like for us and our lessons learned along the way. And I think this slide pretty much says the same thing. We made these strategic shifts, moving from teaching to learning, taking up space to making space and supporting others. And that's really how our reflective practice and deeply embedded evaluation practice help shape and ground our prevention strategies. And with that, I will pass it to you, Cynthia, to speak a little bit more about the evaluation piece.
Thanks, Krista. I'm just going to pause for a moment. That's such a powerful video. It feels really like full. So switching gears a little bit and building on what Krista shared in her slides and what was shared in the video, I just wanted to share about some evaluation pivots that we articulated for ourselves retrospectively based on reflection, looking at our practice, and we shared this with our leadership team, which for folks on this call, if RPE is like Delta funding, both CDC funded, we have a leadership team that really co-steers and co-does the work with us. And we wanted to share with them a lot of the learning that we were experiencing through our own practice. So we put some slides together, and the feedback that we got from them was really, sometimes Chris and I are like, how do we even describe these pivots? Some of them, it's like the Northern Lights. They happen in front of your eyes and change in a second. And you're like, what was that? And so anyway, it felt good to be able to really look at it and articulate what those pivots were, because we felt like if we're going through this, if we share it, it'll kind of help build that culture and make it be real. Like we really did go through this together and learn. And then we felt like if we could share it with others, you might see your own selves in this story. So that was kind of why we wanted to share these pivots with you. So, so the first pivot, whoops, just going back for a sec, is in our movement work in domestic violence, we're really fortunate to be connected to other movements that are also aiming to create healthy and thriving communities and to live into a different world together, a world where we don't have violence and where we thrive together. So I just sort of noted some of the movements that have been helpful for my own growth as an evaluator in this field of preventing domestic violence and related forms of violence. So there was a series that took place during the pandemic called Vision Power Solutions, which was a community of practice of folks working on place-based policy related to climate change and the environment, strategies that, you know, were grounded in community movements and anti-racism and celebration of culture. And that was a really powerful series to take part in. I was trying to learn more about how to evaluate greening urban spaces through that. And it was very immersive, and it had an impact on the way I think about how we evaluate our work. And then also the We Govern principles, which, if you're aware of those, a lot of domestic violence people might be aware of it through the movement, through the Resonance Network, but any of us can learn about and access the We Govern principles that came out of the Resonance Network and the Move to End Violence. And it's governance principles that really put people power and collective power at the center of reimagining what it would look like to govern ourselves together. And so I really recommend folks checking that out. And we do work on those principles as a learning community. And then the American Evaluation Association has also been really supportive in the evaluation pivot. So I just listed a few working groups or their topical interest groups that I participate in. And then finally, we created a network in Rhode Island of evaluators who are aspiring to lean into these same pivots in our own evaluation. And it involves people from our Department of Health, from our philanthropic organizations, from local nonprofits, internal evaluators, university evaluators. And we're lucky we're a small state, so really many of us can be around the same table. And we recently formed an affiliate with AEA, so that's kind of further just helping us network and kind of really solidify the culture change that we're working on. So I'm just going to move along to the second pivot, which has to do with decentering our own expertness and kind of going back to what Krista was saying about how we really pivoted our strategy. So, oops, sorry. So I talk with my hands. So we really pivoted our strategy. So thus our evaluation could not look the same. So by changing what it was that we were going to do in our 5-year strategy, we had to change how we were evaluating it. So rather than having, a lot of times our funders like us to have predetermined, outcomes that we're then going to be aiming for and having work plans that get us towards that, we really took more, and we have been leaning into this for a few years now, but we were forced really to lean into not knowing and to follow the lead of the emergence of the strategy. And along with that, supporting local knowledges. So there's not a lot of literature on these strategies that we're helping to implement and evaluate and share what we're learning from. So it's truly iterative and I think very decentered in terms of expertness. And then I'll just go quickly to pivot 3, try and wrap this section up. So I feel like there's many echoes of what Krista was saying earlier, but we really have cycles of, it's a both and, so we still actually do some outcomes evaluation. It's not like we're just forgetting about a lot of, it's kind of like more traditional ways of evaluating. We do live in a world and we do have funders who we are working with, and at the same time, they often are accountable to more traditional approaches to evaluation. So we're leaning into the both and self-reflection and action, and also embracing more emergent approaches, and then holding stability, because if we want to do this work, we have to figure out how to maintain our funding and also push those edges, and then finding ways to stay in relationship and challenge our funders at the same time, ways to lead from behind, and also be open about how we're changing, because we feel like the more that we're, self-reflecting, if we share about how we're evolving, that could help others who are also leaning in, because this is collective work. And then finally, communicating our findings and lessons learned in new and traditional ways. And I don't know if I have others. No, that was it. So yeah, thank you. I'll stop there for the sake of time. And then if there's any questions, it'll be great to talk about them. And if anyone wants to learn more or reach out, I'm very happy to speak with others further about this. Thanks. And Krista, back to you.
Thanks, Cynthia. I know we definitely planned for more content than we had time for, and I took a little bit more time earlier than I intended. So thank you for being mindful of time, and everyone for your engagement. And just a few more slides to wrap up. The video we showed earlier is from our Voices of Change project. And I'm going to skip through these slides quickly. Our intention was just to leave these in if you wanted to look at them later when they're made available. But these are just the blurbs for each organization, each community partner featured. We used these on social media and on our website and our newsletter. For example, this one is the youth-led organization Youth in Action has continued to create brave spaces for young people to become change agents throughout the pandemic. Together, they build leadership skills to address equity issues in Rhode Island communities and create more caring, fair public institutions and systems. #ThisIsViolencePrevention. And so we used that language and the videos as conversation starters to help our partners feel things, not only think, but also connect to the conversation in different ways. And we received supplemental funding from Delta Impact to address prevention needs related to the pandemic. And that was sort of a tangible way that we lived into the pivot that we were aspiring to make by taking half of that funding and directly supporting the work of these community organizations. And then a good amount of the remaining half went to the video project. And all of those videos, each organization has their own feature video, and then we share the collective story with you all today. And then again, if you're curious of like how we're framing the ways these partners work on shared risk and protective factors, we put just some of the risk factors and protective factors in the slides. And we don't have time to review all of them, but they're there if folks want to reference them. And as we're wrapping up, just to circle it back to strengthening economic supports, we want to lift up this material from the Ohio Domestic Violence Network that was shared at one of our recent site visits. And we are really grateful to ODVN for framing this similar strategy, working on wage equity and worker supports using this broader framework. And really thank you all and lift up this work. I saw Rebecca, you're in the chat. And recognize our Delta cohort who we learned from and with. It was really helpful to see economic supports framed in this way, because that's been our experience working on the strategy too. Everything is interconnected, and economic supports are not only related to income, labor policies, and social safety nets, but also things like childcare, housing, transportation. And that's where our community-based partners are really doing incredible work. And we see that as being directly connected to economic stability and safety. They're stipending their young people who lead their work. They're working on college access. They're working on social connection, leadership development. They're advocating for equitable education systems. And we know that all of these connect to current and future economic stability. with an equity lens. So that was really, really helpful to us and validating to see that lifted up at the site visit from Ohio, as well as I think our Pennsylvania colleagues shared a similar graphic. And we're still learning and figuring out what is our lane as a state coalition. And we recently heard one of the partners on the video project characterize that process as community building, because the videos were the tangible product, but the goals and experience went far beyond the products themselves. It was a process that facilitated trust building, relationship building, and the listening and learning that we're trying to lean into. And we also see our role as leveraging existing funding, as we mentioned, the supplemental funding. And we have a few more examples of ways that we've been able to do that in the state, and securing new funding as well, and new resources where we can directly pass through and fund community organizations, which we also have a few examples. I won't get into the details right now. And listening and learning so we can lead internally to inform our policy priorities at the coalition. We don't have unilateral authority as a prevention team. We are a part of a coalition, which is an organization and also a network of organizations. So we have to hold a lot of complexity and bring our values and our lens, and then have conversations about what that means for our strategy overall. And of course, communicating about primary prevention, which we just shared, one of the initiatives, one of the ways we're doing that, and using data to inform and prioritize prevention work in the state. And I wanted to sneak that in because we're really excited. We'll be releasing our public facing data dashboard soon, hopefully at the top of the new year. And we're really excited we've learned again from our fellow Delta recipients and some of the dashboards that they have worked on and released. And we'll be releasing ours for Rhode Island in a few months. I think I will stop there. Do you have anything else to add, Cynthia? I know we're at time.
Oh, thank you. Great job.
Thanks. Back to you, Ashley.
Thank you so much, Krista and Cynthia and Mark. I was thinking the same thing. I really appreciate you ending on this slide because especially as we all think about the ways that our work can advance health equity, it's so critical to think about what is our role? Where do we fall in all of this? So I love it so much. I really just want to appreciate you, Krista and Cynthia, sharing the pivots that you have really courageously made. There's no like roadmap or guidebook to addressing underlying issues, to advancing health equity. And so sharing these stories about your work is it's so critical to all of our learning and ability to move forward. So thank you from the bottom of my heart to all of you. I did have two questions that I wanted to ask Nikki, Cynthia, and Krista, but it was more important to hear about your work. But I'm going to ask you all if you would answer those maybe via email, and I will share them out to our colleagues via our social media. So, because your wisdom and experience is just so fabulous. We do have a session 3. So one thing that I wanted to point out to everyone on this call is that since these sessions are closed, meaning they're only being open to CDC recipients and subrecipients, they're not publicized on our website. So the way that you're finding out about them is probably through your CDC project officers. So we really are kind of leaning on you if you want your subrecipients to be involved in these to get the message to them and invite them. So just wanted to plug that. But session 3 will be happening the first week in November, and we'll be looking at we'll be hearing more from Rhode Island actually with partnering with sectors and movements, some of the local work happening with their subrecipients. And then we'll also be hearing from Indiana, looking at some of their work with disability justice movements. So you all, if you got here today, you should have this announcement too. But I just wanted to thank you all again for spending the past 90 minutes with us. This was recorded. I'll go ahead and send an email out with the recording, the slides, and that resource document. And then of course there will be a follow-up survey that we'd love if you would fill out. So with that, happy Friday to you all. Thanks again for being here with us. And thank you so much to our guests. Thank you to our captioners. Thank you all. I hope you all have a wonderful weekend and hope to see you on the 3rd for our 3rd session in this series. Take care, everybody.
Thank you.